The risk factors for hepatocellular carcinoma are well known and include cirrhosis, the hepatitis B and C virus, as well as alcohol consumption, smoking, diabetes, and a more emerging risk factor that we are seeing is obesity. Hepatitis is inflammation of the liver, and I want to say that it is the major risk factor for liver cancer. So globally, they account hepatitis B virus and the hepatitis C virus account for an estimated 78% of global hepatocellular carcinoma cases. The way it's caused by is through contact with blood or the bodily fluid of an infected person. These viruses, hepatitis B virus and hepatitis C virus, induce malignant changes into a cell by affecting a cell's gene expression. What that does is promote and even repress cellular pathways. That prevents a cell from undergoing a form of cell death and can also promote viral replication. That ultimately leads to cirrhosis, which is damage of the liver, and damage of the liver can lead to permanent scarring. And liver cancer almost always occurs after cirrhosis is present. Prevention of cancer can be grouped into primary, secondary, and tertiary. Primary prevention reduces the exposure of a risk factor, in this case, a risk factor for liver cancer. Now, given the list of risk factors that we know for liver cancer, HCC is actually preventable. So for liver cancer, the most successful prevention measure is the vaccination against hepatitis B. This vaccine is available for all age groups, adults and children. There is the more common vaccination schedule is a 3-dose intramuscular injection, but there are approved 2-dose and 4-dose vaccinations as well. Now, vaccination for hepatitis C is unavailable. However, there are forms of primary prevention, and those are targeted primarily at aiming to promote safe injection practices as well as screening of the patient. In addition to these primary prevention measures that I mentioned for the 2 viruses, reducing one's alcohol intake, smoking cessation, as well as managing obesity and diabetes are other ways to prevent liver cancer. Now, as far as secondary, when we think about secondary prevention, we're really thinking about curing an agent that's involved in the formation of a cancer. So in this case, you aren't able to cure an infected individual, a virus-infected individual. Therefore, antiviral drugs are used to help decrease the risk of liver cancer. Now, tertiary prevention includes treatment. So treatment involving chemotherapy drugs as well as antiviral drugs to prevent the recurrence of the cancer.